Healthcare's in trouble. Let's talk about that. The auto industry is a good example of why free enterprise is not going to reduce the cost of products. There is so much talk about turning healthcare into private industry in the states and how this will create competition and reduce costs. And I would like to make 2 points. One, when I was 16, I bought my 2-year-old Ford Galaxie for $5,000 and it had 25,000 miles on the odometer. That same quality of car today, 60 years later, would cost $25,000 or more. We have more companies with more variety than ever, yet prices keep climbing. Secondly, things like cars, cosmetic, and other products are not something that is required for your life to exist. Healthcare is. This alone will prohibit cost reduction because insurance, pharmaceutical, and hospital companies know people have to have their product. It isn't a demand issue. It's a necessity issue. This is why the only program that will work for healthcare is when the government, who has the people's concern at heart, not profit, will work to lower medical costs and ensure people receive high quality and affordable insurance. Medicare proves this point. It's been in existence for years. Doctors and hospitals rebelled against Medicare and Medicaid when it first came out a few years back, but when they saw it would not go away, the only choice they have is to accept Medicare if they want to continue practicing in the area they spent thousands of dollars to become educated in. A regulated healthcare system will provide good healthcare that will not bankrupt people. Doctors, pharmaceutical companies, and hospitals and medical care centers will have no choice but to come on board. They can make a reasonable living in their field. Other industrialized nations have discovered this secret, and they've worked through these issues and are making it work. Yes, taxes will go up, but not as much as the ongoing increase in insurance costs that happened to me every year for 30 years. I had health care with companies. Research this well. Find where any commercialized business has been in the best interest of the average person. Cars, drugs, electronics, whatever. The free market has provided more products, many unnecessary, but at a great cost to the average person. Healthcare will be the same if we allow it to continue. We need a government-controlled, single-payer, well-regulated healthcare program. That's the only one that's really going to work. Those who are fighting this are the industrialists. They keep raising prices on all those products they sell you, not the average citizen out there. The average citizen gets hurt in all of this. We can continue to have a free market in things like cars and products because we can choose to do without them. But healthcare you will have to have in your life at some point. It's important we stay focused on getting a program that takes care of everyone, including the average person. So that's why I am supporting the idea of a single payer healthcare program regulated by the government, whom we control in the long run by how we vote. This is Vic Vogel, and this is my opinion only.